Did Donald Trump just raise the prices for Medicare Advantage? This year in 2026, we're seeing a lot of unhappy customers in the Medicare Advantage space. A Google search will reveal news articles talking about benefits being cut, premiums rising, copays rising, and higher maximum out of pockets. A lot of people I'm talking to are blaming Donald Trump. So, did Trump really cause Medicare Advantage prices to rise? That's the topic of this video, so let's get into it. Folks, the reality is that Trump had only been in office for about 7 months when the new Medicare Advantage plans were released to the public on October 1st, 2025. And they were being planned months before that. In fact, most of the Medicare Advantage plans that were released on October 1st, 2025, were already being planned back in June or July of that year, which means that Trump had only been in office for about 4 months when the companies were finalizing those new plan changes. As far as I know, Trump has not made any changes to Medicare between his inauguration date in February and the time that the 2026 Medicare Advantage plans were being put together. But let me clarify this. I did not say that Trump has not impacted Medicaid, because the DOGE cuts have definitely had some impacts on Medicaid. But keep in mind that Medicaid is a state-run program where Medicare is a federally funded program. Medicare and Medicaid are apples and oranges. You're comparing two different programs. So, what really caused this year's huge spike in Medicare Advantage premiums, copays, and reductions in benefits across the board? To answer the question, we've got to look back a bit further in time. On August 16th, 2022, the Inflation Reduction Act became law under Joe Biden's presidency. This law had two very major effects that immediately cut prices for people who were using Medicare Advantage, especially drug prices. On the surface, it seemed like a great thing, but I suggest to you that these price cuts actually led to higher prices and less benefits in the upcoming plan year for 2026. Although the Inflation Reduction Act was passed way back in 2022, the first major change didn't take effect until the 2024 plan year. That change included a $35 price cap on insulin. That seemed like a great idea, and for everyone on insulin, it truly was a lifesaver. The second major change that affected Medicare Advantage due to the Inflation Reduction Act took place during the 2025 plan year, which was just last year. That change capped the maximum out of pocket for Part D prescription drugs from around $8,000 per year to just $2,000 per year for plan year 2025. And again, that was just last year, right? So here's the question I pose to you. Where did the money to reduce insulin and drug prices so drastically, where did that money come from? Did it come from the government? No, not really. The law just capped drug prices by regulating the companies that offer Medicare Advantage to consumers. It did not provide funds to reimburse those companies for cutting their prices. It just told them to cut their prices. In short, the law said to Medicare Advantage companies like Humana and Aetna, hey, you've got to cut prices because it's a law now, because we said so. And again, folks, keep in mind that the biggest change, that price cap of $2,000 per year for Part D prescription drugs, just went into effect this year in 2025. By comparison, capping insulin at $35 was relatively easy for the Medicare Advantage companies to absorb. But the $2,000 price cap on Part D prescription drugs, not so much. Let me explain why. I frequently talk to people who are taking specialty medications that cost more than $20,000 per month. When you cap the maximum out of pocket for Part D prescription drugs at $2,000, what happens is that a lot more consumers just prepare themselves to meet that $2,000 max out of pocket, and the incentive for them to keep their drug prices down just sort of disappears. Plus, the sad truth is that many doctors are incentivized to prescribe expensive medications to their patients. So, therefore, many patients end up feeling like they have no other options. Right now, there's a huge push for GLP-1 drugs that's glucagon-like peptides such as Manjaro and Ozempic, doctors are incentivized to tell people that these expensive medications are their best option, while consumers themselves are enticed by the prospect of losing weight. So the end result is that a lot of people have just started planning on meeting their $2,000 Part D prescription drug maximum. But just because drug prices are capped at $2,000 for the consumer, it doesn't mean that drug prices are capped for the Medicare Advantage companies. The companies that provide Medicare Advantage plans are struggling right now because they're trying to figure out how to get the money to compensate for runaway drug prices that have been passed on to them. Although the consumer did get a price break on their prescription drug prices, they were penalized on the flip side by higher copays, higher premiums, and less benefits, like over the counter cards and food and grocery benefits. I've been selling Medicare Advantage for 5 years now, and I've watched all of this happen. In my opinion, the Part D prescription drug cap is the biggest reason that we're seeing dramatic reductions in Medicare Advantage benefits, increases in copays, premiums, and higher maximum out of pockets on the medical side. While this is just my opinion, I think it makes a lot of sense when you think about it. The $2,000 max out of pocket for Part D prescription drug prices was a massive savings for patients. It reduced their out of pocket costs almost $6,000 from the previous year. As a result, many consumers just resigned themselves to the fact that, hey, they're going to reach their max out of pocket anyway. So why not add on another expensive medication or two, right? After all, if it's not going to cost you anything extra to add a new medication, then there's no financial incentive for you to keep your medication costs low, is there? I was talking to a client yesterday who was actually really upset with me about the big increases and benefit reductions for Medicare Advantage in 2026. She said to me, "That's the purpose of healthcare, right? So that you can use it, right?" I didn't actually respond because it might have come across as political or insensitive, but I thought to myself, no, not really. The purpose of health insurance is for the health insurance companies to make money and to make sure that you have insurance when you really need it. The purpose of health insurance is not to increase utilization, but to reduce utilization and control costs in order to keep the health insurance prices down. The new Part D prescription drug maximum of $2,000 has encouraged people to use more expensive medications, in some cases, even when they're not really necessary. Medicare Advantage companies are citing increased utilization as the reason that they had to reduce benefits and increase premiums in 2026. What I'm suggesting to you is that the biggest increase in utilization came from Part D prescription drug price caps that were implemented last year in 2025. My name is Justin Hayes, and I'm a licensed health and life insurance broker specializing in Texas. I'm also licensed in Florida, Michigan, and several other states. If you don't have a health insurance broker, you should probably get one. It doesn't cost you anything to have a broker, and oftentimes we can provide you with valuable insights to help you make educated healthcare choices. Please like and subscribe to support this channel and get more valuable insights in the future. Also, visit me online at justinsurance.net because this is about the net, not the gross. That's justinsurance.net. You can book in a free consultation with me or send me your referrals. If you have any questions about health insurance, don't hesitate to reach out. It's totally free just to talk. I look forward to speaking with you soon.